The talk was very interactive with two great examples how the human mind reacts on sound. It was very good that the problem of sound was enlightened very clear.
I knew that sound was important. Which I was not aware of is all the things that we can do when building a hospital, when managing the distribution of the space. I mean, it's much more that we can do than I thought before entering the speech.
There is research saying that the sound that high noise levels, for example, can raise our heart rate. It creates stress amongst staff. There are not directly related to hospitals, but there are studies that say that high noise levels in the workplace lead to a higher absenteeism, but also for the patients.
So you can't hear what the surgeon says sometimes, or you're not aware of any alarms, because you're overkilled from alarms and sounds all the time. As we heard, the peak is about 90 decibel. So I think we have it through and through.
Yes, over the last 40 years we can see an increase in the background noises in hospital with a total amount of 15 dB. So 40 years, an extra amount of noise of 15 dB. And 10 dB increase is perceived as a doubling of the sound effect on the human ear. So this is a lot of noise.
We became a new furnishing in the ORs. It's all glass, and it's metal, and it's reflecting everything. So the sound is rising.
Evidence-based design is a way of thinking, actually, based on the knowledge we have from previous buildings and previous scenarios. We can see how certain decisions in a building affect the function of that building, and specifically in hospitals, we can look how certain design decisions affect the patient's well-being.
The influence on patient is very well documented. We have several studies showing that poor sound environments will affect both their physical response, such as their blood pressure, heart frequency, and as I mentioned earlier, their sleeping patterns. And if you take it one step further and see what that leads to, it leads to more pain, and more pain leads to more medication.
And the second thing that I've learned today is the importance of the materials you use in the building, and the low cost that it has comparatively to build a sound sensitive environment.
We know that we have to innovate, and we have to come up with new ideas about the environment, and sound and waste is both part of the environment. So we have to go on steady with our research and try to stimulate innovation.
I also can imagine that too much noise leads to burnout, because some of my colleagues they suffer from. Not only nurses, surgeons, also the whole staff.
I expect the awareness of sound environments to be just as high on the agenda as the awareness we have for daylight and the awareness we have for a good air quality. We're on the verge of well, it's our mission to make people aware, and we will keep doing that until it's worldly known.